Okay, and we're here. It's 4:51 and Kyle and I are accidentally matching. We both have on camo and black pants. Alright, here we go. Okay, so we're in and it is 7:50 and they got my IV going, took my blood, and started my Pitocin at 7:30. And so far the worst part has been the IV and blood draw for me because I'm scared to death of blood. But they checked me and I am at 1.5 still, so hopefully we'll get this going soon. So now it's 10:45 and they haven't checked me again yet, but I'm having contractions that I can feel. They're not very painful yet, so I guess I don't really have much of an update other than that. Kyle and I are exhausted. My Fitbit said that I slept for 2 hours and 25 minutes last night. How do you feel, Kyle?
Tired.
He's tired. He just went and got a Starbucks, so I'm just watching him drink it, wishing I could, enjoying my eyes. So it's 4 o'clock. And they finally broke my water. They said my doctor was tied up in the operating room. And I'm still at a 2, so this is going very, very, very slow. But I just got to drink some apple juice because my blood sugar was 68. So that was amazing. And I'm laying on my side because my butt hurts so bad from I can't get up and walk around, so my butt hurts. What else?
That's it.
I think that's it. I hope this is gonna get real now. Okay. It's 6:10. I just got my epidural. And I'm at 4. And what else? The epidural was a lot more rough than the last time I remember. Yeah, it was a lot of pressure, but I'm starting to feel numb now. So I think that's gonna be it until after. Okay, and as you can see, we are now home, and I just every time I try to film, something happens. My cat's rubbing on the stand. Stop. Come here. So I had intended on kind of like finishing the story of my labor and delivery when we were in the hospital, but did not get that accomplished. And now it's already, it's a week and 1 day since Brian has been born. So like I just kept rethinking in my head, or I've been thinking even now, like so far as we're home and stuff, like, you know how you always see on Instagram, Doug, come here, Doug, come here. You know how you always see on Instagram, like those pictures, like Instagram versus reality, and every single second of my life is reality. So it's just like, you can't, I don't want to film that, but I mean, I know it's true life, it's how it goes. But anyway, so I'm home and I'm ready to finish the story. I had to go back and watch the clip, the last clip of where I left off, and I seen it was, I said it's 6:10. I was at a 4. I got my epidural, and it was it wasn't bad, but it was definitely worse than my first pregnancy. When I got that epidural, it was like no big deal at all. This time maybe he had to like reposition it a few times, and so it took a little bit longer, and he was just kind of like moving it around, and I wouldn't say it hurt. I don't know that hurt is a word. It's just the weirdest pressure, a lot of pressure, but the weirdest pressure. And he kept like doing that, and it's so hard to sit still while they're doing that. And anyway, but it ended up, I got it, it worked, everything, nothing went wrong with it, so that's a win. And so that was at 6:10, and Brian was born at 9:12 p.m. So at 6:10 I was a 4, and then at 9:12 he was born. So after I got, my water broke, and after I got the epidural, things went like that. And I never know, like I feel like this was my last pregnancy too, or my last labor. Like I never know when is the right time to get my epidural, like, because like obviously you want to stick it out as much as you can. Hang on. Brian's right here, and he keeps losing his passy, but obviously you want to stick it out as much as you can, but so, and then they also say like, but don't wait until you're in absolute, like you have to have it that second, because she's like, I need like 30 minutes to give you a bag of fluid, I need time to get him here, so give me like a heads up of when you're thinking. And so I'm just gonna hold him. Let's go ahead and introduce him now. Come here. Come here. So, here's this little guy, and I'll show you a close-up. His hair is so funny. He got his second sponge bath at home yesterday, and his hair looks so greasy again today. I don't know why it's so greasy all the time, but let me show you a close-up so you can see how it sticks straight up. Oh, you know, look at the camera. Can you look at the camera? See? So anyway, I never know like when is the right time to get the epidural, and luckily my last pregnancy and this pregnancy, they came in and said, if you're gonna get it, you have to get it now. In this case, the guy was going back in like an hour or two do a C-section, so she was like, it's now or like possibly last minute. So of course I chose now. But I don't know why I didn't think about getting it sooner, because obviously that makes my body relax and it goes a lot faster. Not that I'll keep that in mind for next time, because there won't be a next time. Are you hungry? I think the boy's hungry. You hungry, boy? So whenever it was time to push, the nurse came in and said, you know, like she hadn't checked me in a while since I was at a 4, and she said, we're gonna come in and get like the labor table ready, and let me go get him a bottle. 1 second. Okay. So the nurses came in and said that she was going to get the labor table ready, and she hadn't checked me in a while, and she said, if you feel the urge to push and have that pressure, let me know. And so there were several of them in there. I had a lot of students in and out. So there were several people in there kind of like getting everything ready. And I was just sitting there, and I was like thinking in my head, you know, I'm going to poop on this table. And I was sure that that was what was going to happen. And I just kind of like sat with it for a few minutes, and then I told my husband Kyle, I said, I think I'm gonna poop on the table. Do I tell her or do I just do it? Like, what is the appropriate thing here? And then she kind of was like looking over, and she could tell that maybe something was up, and so she's like, what's going on? And I said, I think I'm going to poop on the table. And so she laughed, and she was like, I don't think that that's what you're feeling. I think you're feeling that pressure that I was talking about. And so she checked me, and she's like, it's time, let's do this. So they called my doctor. So my doctor was at home, and she had to get her daughter off somewhere and get back there. So it took a little bit of time, but that was no big deal at all. And when I pushed for 45 minutes, and then he was born at 9:12. And with my first pregnancy, I pushed for 1 hour and 1 minute, and this time I pushed for 45 minutes. So everything was really easy. Probably TMI. I did not even have to get a single stitch, nothing. With my first pregnancy, I got 1 stitch. This time I had nothing. There was no issues or anything. So all that stuff that I bought for that Freedom Mom kit, I'm here to tell you I didn't use a single thing of it. And like, I did use a few of the like ice pack pads, but the hospital provided those. So I was trying to use everything that they gave me before I used my own, you know, not knowing what I would want at home. And I didn't need any of that stuff. I don't think I even opened half of it. So if you guys haven't watched my What's in My Hospital Bag video, I'll link it here. But I'm going to tell you, and I said in that video, I'm packing everything. You don't need that stuff. You don't. I didn't wear almost anything I took. I wore my labor gown and my going home outfit. The rest of the time I asked for a hospital gown, and I wanted to be comfy and ruining their stuff and not mine. By ruining their stuff, you know what I mean. You're a bloody mess, and I just wanted to be in that and not have to worry about it. So you don't need half that stuff. But so yeah, the labor was so easy, and then after, what's happened is the exact same thing that happened to me in my last labor. Is my tailbone hurts crazy, and I'm wondering to myself why I don't use this chair more, because this is actually really comfortable. My cat's trying to get in the bedroom, but the biggest problem is I just can't sit back on it and apply pressure. And I am here some, but this kind of like sits straight up too. But there's also a huge pad underneath me. So this is really comfortable. I wonder how my husband would feel about having this in the living room. But that's my only problem, and my tailbone hurts so bad, and so I can't do a lot. I feel, you know, just like get up and sit down hurts so bad. Like, it gets to where I cried several times in the hospital, and my poor husband had to do everything. Like, I'm not gonna talk about breastfeeding or not, because that is emotional for me, because it's hard. But in the hospital, I did breastfeed the whole entire time, and he had to do everything. Like, I only changed 1 diaper in the hospital, and that's it. He would have to like hand the baby to me, take him back, change his diapers, take his clothes off, you know, like, he did everything. And I just laid in that bed and was so in pain. And they gave me several medications, but I don't think that anything seemed to help. I do know that they sent me home with a prescription of, I think it was Tylenol with codeine, and that was amazing. I could take that every 6 hours, and that made it to where I felt like almost normal. Excuse you. Woo. But now that's gone, because like I said, it's been 8 days. So that supply's run out, and so now I'm just doing the Motrin, which it's not doing anything today. I've been really sore. It's been my first day without the Tylenol. And so I'm back to feeling kind of rough, but you want more? But, you know, if that's all that happened, I think that also that's a win. I keep telling that to myself and everything because I know I hear all these crazy labor and delivery stories of all this tearing and all these complications, and really mine was a breeze. You know, so what? My tailbone's going to be sore for a few months. It was last time too. It's not the hugest deal. I mean, it's not the hugest deal of things that could have happened. So while it doesn't make me less of a baby about it, I still know that that is, I don't know, a really good result. So what else? We stayed the mandatory 2 nights in the hospital and went home. And my next video will be like us getting ready to go home, and then Brian meeting his baby sister, his big sister. Maybe I should say what he weighed and all that. So like I said, he was born at 9/12. He weighed 6 pounds 13 ounces, was 20 inches long, and yeah, he was perfect. He didn't have any kind of complications or anything. He was born at 39 weeks since I had gestational diabetes. So that caused them to monitor my blood sugar every 4 hours in labor, and also monitor his after. They would prick his heel to take his blood sugar before he would eat. And he never had any kind of issue at all. His blood sugar levels were like usually in the 70s, which they had to be at least 45. So he never had any kind of complications. You know, they said that usually babies of gestational diabetes mothers are large. He was in no way, shape, or form large. I don't know, I think it was just overall a really good experience, and I didn't have any kind of issues. I'm going to be honest now that I've been supposed to take my blood sugar still until I go back to the endocrinologist. I think I go next week. But today was the first day that I've actually started doing it again. Life is too nuts. I didn't take my blood sugar, but so my fasting one this morning was 95, and then my 2 hours after lunch was 96, and then, or my 2 hours after breakfast was 96, and then my 2 hours after lunch I haven't taken yet. So I was kind of surprised it was 95 fasting, because when I was pregnant it was always like, it was like 78, 79, 80, like fasting. So 95 is quite a bit higher, which I still think that's normal. I don't even know what it's supposed to be like post pregnancy, but I know during pregnancy it was not supposed to be over 120. So I think that that's going to be it for this video. I hope you liked it. Please consider subscribing if you haven't already. Give this video a thumbs up. Whoa. Can you say until next time? Say until next time.